Each year, millions of adults in the U.S. are diagnosed with vascular disease, and it's no wonder. With over 60,000 miles of intricate arteries and veins throughout the human body, there are bound to be complications due to blockages, weakening of the blood vessel wall, and other issues impacting the circulatory system. With an aging population and the growing incidence of risk factors such as diabetes, high blood pressure, obesity, smoking, and the disproportionate incidence of vascular disease in our minority populations, the management of vascular health is becoming a key focus among today's healthcare leaders and providers. As with any medical disease or condition, it takes an entire team of dedicated professionals to find new ways to efficiently diagnose and treat patients, as well as to improve their long-term care. In vascular health, the leader of the team is today's vascular surgeon. Only vascular surgeons dedicate their entire training and practice to address the full spectrum of vascular health, as well as provide comprehensive care that includes preventive, medical, surgical, and minimally invasive solutions. Through ongoing education and research, as well as pioneering new techniques, vascular surgeons are on the leading edge of clinical breakthroughs that are transforming vascular health. As part of their comprehensive approach, vascular surgeons partner with other healthcare professionals to provide quality care tailored to each patient. This patient-centered model is vital to help all physicians manage vascular health in at-risk populations and promote healthier lifestyles in the future. Vascular surgeons are involved in every part of the disease process, from making the diagnosis to the management of disease. Vascular surgeons are comprehensive leaders in vascular health. Today's vascular surgeons are creating a new chapter in the vascular health story with improved patient care, better outcomes, collaboration, and leadership. Surgery is only part of our story.
Before we get started, I would like to take a moment to acquaint you with a few features of this web event technology. At any time, you may adjust your audio using any computer volume settings that you may have. On the right-hand side of your screen, you will see the chat and Q&A window. Please note, if you do not see the chat or Q&A windows, make sure that you are not in full screen mode. In the Q&A area, there is a large window which holds all of your sent messages and a smaller text box at the top where you will type in your questions for the panelists. To send a question, click the text box and type your text. When finished, click the Ask button. The chat feature is for audience discussion only, so if you want your questions answered by the panelists, please submit them through the Q&A. We are joined today by Dr. Kim Hodgson, immediate past president of the SVS. At this time, I would like to turn the microphone over to Dr. Hodgson for opening remarks and panelist introductions.
Thank you very much and good evening. Welcome to another of the SVS Town Hall series, tonight dedicated to branding the vascular surgeon and the specialty of vascular surgery itself. I'm joined tonight by my co-moderator, Dr. Joseph Mills, who's Professor in Chief of the Division of Vascular Surgery and Endovascular Therapy at Baylor College of Medicine. We also have joining us Dr. Bernadette Olivola, who's Professor in Chief of Vascular Surgery at Loyola University Health System. Dr. Linda Lee, who's Assistant Professor of Cardiovascular Surgery at Houston Methodist DeBakey Heart and Vascular Center. Dr. William Schutz, who's a vascular surgeon with the Texas Vascular Associates. And lastly, Mr. Mike Chapman, who's the Vice President and Account Director for Springboard Brand and Creative Strategy, consultancy SVS has been using over the last several years to develop the products you'll see here today. So welcome again. And at this point, I'm going to turn it over to my co-moderator, Dr. Joe Mills, to open up the discussion.
Thank you, Kim. Well, welcome. Tonight I want to introduce and discuss how we got to where we are now with the branding process. And I'll talk about a toolkit we've started to prepare, which we think our membership will find useful. And after I introduce that and give some background, Mike Chapman from Springboard, with whom we've been working, will run through the mechanics of how our members could use these different tools we prepared so far. So just to go back in time a little bit, back in 2018, branding was identified by the SVS membership and its leadership as the #1 strategic objective. And so I was asked as the head of the public and professional outreach committee to work with our group to try to figure out how would we go about branding ourselves and how would we do it. And this work was the work of the committee. Every single person on this committee contributed a lot of effort to this, but I want to highlight the contributions of Dan Hahn, Linda Lee, Donna Mendez, BJ Pierce, and especially Bill Schutze and Tom Forbes, who weren't on the committee, but I asked them for a lot of help towards the end of the toolkit. And they did some extra work at the end to try to get us to where we are right now, which I think is a pretty good place. So what were the goals of this whole thing? One was to increase the general knowledge of the public and also referring base and also consumers about what vascular surgeons are and who they are and what they do, and kind of differentiate and elevate the perception of what our specialty is. So we plan ultimately to roll this out to referral sources, hospital administrators, medical students and surgery residents and consumers. But partly because of COVID and partly because of mechanics, we've started by branding the referral sources in the first phase this year. And I'll show you what we've started to create for that. But the other ones will subsequently follow. So why do we want to brand ourselves? One is to increase the recognition of what we do. It's been a universal feeling that we got from in-person meetings with members, as well as some outreach work that we did, that nobody knows what we do. Especially referral sources aren't too clear on sometimes who to call for which vascular problem. And that may vary locally, but a general perception was that we always aren't necessarily the first people that are thought of. It's especially true not just for referral sources, but also hospital administrators. And finally, patients get confused because there is competition in this area. So other specialists brand procedures, for example, but they don't really brand what we do. So we started by meeting as a committee and coming up with goals and direction. We had interviews with SVS members. We had Springboard help us with interviews with referral sources and with hospital administrators. And they also did a consumer awareness survey. I believe that was conducted on Facebook. So what were the key findings of all that? So all of these may not apply to each one of your individual practices, but they are a global perception of where we were when we started this campaign. And you may not like to hear it, but this is the general status of where we are. There's a lack of real knowledge about the vascular care and expertise that a vascular surgeon provides. There is confusion over who best treats vascular issues. And a lot of this sometimes is driven by local referral patterns. And we thought that the SVS would be in a good position to help its members of all types, whether they're in academic practices, private practices, large groups, small groups, rather than have everybody try to brand themselves in some way, to give the membership some help. There is still a widespread misperception that surgery is the only treatment modality of a vascular surgeon. So we're often seen as highly technical. And if someone obviously might need a vascular operation, we call vascular. But if they look like they could get by with something less, we might call a cardiologist, or they might call a interventional radiologist. And finally, the aspect that seemed to hit home a lot, both in our research and also with lots of personal conversations, is we pride ourselves in the fact that we provide comprehensive care. So that starts with preventive things in patients with early disease, to early diagnostics, to medical therapy, and to finally treat the patient more invasively if they really require it. But we think we do that better than any other specialty, and we think we're more trained to do that. So if you look at what we think we are versus what we're perceived as being, and so I get into this argument sometimes with administrators and with my department chair, but even if the perception is wrong, it's still the perception, right? So there is some reality to the perception that views us as just surgeons. And so if we view ourselves as something else, we have to shift this vision. So rather than bill ourselves as highly technical surgeons that were relied upon for episodic interventions for some severe vascular problem, we actually want to expose what we do earlier in patients' disease courses. And a lot of us do this already, but it's something we need to brand. So the problem with this is, if we're going to do this, if we're going to brand ourselves as comprehensive, then we have to be that way. We can't turn a patient away because it doesn't look like they obviously need surgery yet. We need to be willing to see those patients, work them up, talk to them, counsel them. And a lot of us do that already, but we need to brand that. So how is the SVS going to help? It still requires local and regional effort, but the idea behind this toolkit was, rather than you have to go out and create a lot of different materials to try to brand aspects of your practice, we could help you with that. So the first thing we did, and I think most people have seen that, and I believe it played right before we started here, were 2 videos we've created that tell the comprehensive surgery story of who we are. And the other thing that took home and it took people took the heart, besides the comprehensiveness of what we provide, is that surgery is only part of our story. So there's been a lot of discussions among the SVS and individual members over the years about, do we still call ourselves vascular surgeons, or should we call ourselves vascular specialists? And I don't come down on either side of that, but I think the point of this is that we're the only specialty that really is a vascular surgeon, but we also do all the other stuff that other specialties do. So we do non-invasive care, and we do minimally invasive complex endovascular care. So we don't want to lose the surgery part of who we are. So we thought this was a good phrase to use to brand that. So certainly we are surgeons, but it's only part of our story. I think that message hit home with the membership. So we worked now over the last year to create these branding tools, and I'm going to outline 1 or 2 quickly, and then I'm going to introduce Mike Chapman, who's going to run through how you might use these on your when you log into the SVS website. So what's the goal of this? It's to enable SVS members to help brand themselves as SVS members and as comprehensive vascular care specialists, and to have more productive referral conversations, perhaps build aspects of their practice that they see they want to branch into and they don't have a big practice in that area, to reinforce areas where they're already doing well, because if you don't pay attention to something, you can find out that practice patterns shift. So we've created a set of downloadable branding tools, many of which are also customizable. So Mike will go through how that's done, but basically it allows you can use the SVS branded materials as they are, either through email attachments or print them out or have them printed professionally through the SVS to use for your patients or your referring docs, but you can also customize many of them and put your own practice logo at the bottom, list your physicians. Some of the images that we'll show you can be modified so that you can insert, instead of having a picture of Dr. John White or Bernadette Alivola or one of her group on the branding thing, you could brand your own surgeons and nurses and advanced care providers. So you can modify these to meet your own needs. So we're going to introduce this tonight. So these are all the tools, and I'm not going to go through them all in detail because Mike's going to walk you through that in a minute. But what we've done so far is we've created 3 modules, and we decided to make this modular because really when you're talking to referring docs, you're usually talking about specific diseases. So the ones we've created so far are for chronic limb-threatening ischemia, for diabetic foot ulcer, and for abdominal aortic aneurysm. And basically the printed versions would all fit on 1 sheet of paper if you double size print, and they're organized in the same fashion. So they're branded by SVS at the bottom. They describe the condition. They talk about when you would refer that to a vascular surgeon, why you should refer it to the vascular surgeon. And on the back side of that, on the printed version, with Tom Forbes' help, I took all the evidence-based guidelines. So the reason I picked abdominal aortic aneurysm and CLTI and diabetic foot to start with is we've just recently finished guidelines for all those areas. So I think it's really powerful when you talk to referring physicians and even patients about why they should refer to you, is if you can go through the guidelines and see how there's evidence that backs up, how often do I get seen for this problem? What are the considerations that should happen in my care? So each one of these, and Mike will show you how those work, is made on this 2-page format. And these allow you, for example, down here, you can insert the logo for your own practice, so you can modify it a little bit. So I'm going to close with that. And while you're, I'm going to tee up Mike Chapman here in a minute. His group at Springboard has been a really good help. So when we started on this, the first couple meetings, I was sitting there thinking, I don't know if we're going to be able to get anywhere. And then with the help of the 16 members of the PPO and the Springboard group really listened, I think we've worked together really well. And I think you'll find this useful. So the kind of questions I want you thinking about are, would you find this toolkit useful? If you like these modules, so we have 3 that are already done, should we use this format and create additional modules for the other major conditions we treat, such as carotid disease, stroke, thoracic outlet syndrome, DVT, access related problems? Will you use the customizable tools? So Mike will show you how almost every one of these tools can be customized to your individual practice. Do you see yourself using that? And then we all kind of get tunnel vision sometimes when working on a project. Are there tools that you think would be useful in branding your practice in your region or your locale that we've left out that we could create that would help you? So I want you to think about these questions while Mike from Springboard, Mike Chapman, runs through the toolkit mechanics. And certainly if you have other questions, use the chat function, and we really want your feedback. So the whole point of tonight is we put a lot of effort in this, but we haven't gone so far, we can't redirect what we've created so far. So before we go ahead with more modules, we really want feedback about whether this is something you'd find useful. So I thank Kim again for inviting me, and I thank the SVS for having the confidence in our group to work on this. And I thank Mike Chapman and Springboard and Angela and Ken Slaw and all the folks at SVS who've really been, this was identified as a key, as the major problem for our specialty. And I think all the people that have helped on this have taken it really seriously and worked together well. So we're interested in your feedback. Thank you.
All right, thanks, Joe, for that. Do you want to go ahead and key up Mike?
Yeah, so Mike Chapman has worked with us the most. I'm on Springboard, and they have a lot of branding and advertising experience, and they've helped us. They were really good at listening, and they came to us with some ideas at first, some of which we found a little funky, and then they would listen to what we wanted to do, and they'd go back and redesign them. And I think you can see from the video, it ends up, the videos are pretty high quality, and they've also, they'll show you on the website, but there's snippets from those videos you can choose to use. So if you don't want to put the whole video on your website, or you don't want to put it on a Twitter post, there's little excerpts that address certain aspects that we want to brand, like comprehensiveness of care or diversity of who we are or whatever. But there's 5 different snippets, I believe, that are all less than 20 to 30 seconds. So they would fit fine on many social media posts. So if you want to use those, and we're looking at trying to make those modifiable. So if you use one of those, at the very end, you could put up your own picture of your own group with your practice logo. So you'd be allowed to individualize that somewhat. You wouldn't be able to change the content of the actual video, but you could brand your own practice and your own group as members of the SVS at the end. So Mike's going to run through, if you were to log in, how you might use these tools, and if you wanted to customize them, how you might do that. And they've been beta tested so far. It seems to work. I'm sure there's going to be some issues when you all try to use it, but the Springboard's committed to help us with this. So there'll be a frequently asked questions section, and there'll be online help. Like when your Epic gets stuck, you have to talk to someone. It'll be hopefully a little more responsive than that. But anyway, I introduced Mike, who's been great help. Thank you, Mike.
Great. Thank you. Thank you so much, Dr. Mills. I'll echo the thank yous as well to Ken and Angela, who have been very, very supportive and have had a wonderful vision for these different tools we're building. So I want to, one of the things I want to make sure I do today is help all the visitors to this town hall access these tools and navigate through them. So that's kind of the goal here. So I'm actually going to start with one step backwards, which is something that you're going to get in your email early next week. So the first thing everyone's going to need to do is log in. Everyone needs a unique login, a unique password. And the way that we've been able to do this securely versus sending everyone a password is to actually use a lost password function of the system. So I'm just going to scroll down this real quick. Very, very simple. You enter in your password, or you enter in your SVS email, the same one that you use for other things at SVS. You click the reset password button. You're going to then get an email from the system. It's going to give you a temporary password, which you should write down. And then it's going to give you the login URL that you're going to use from this point forward to access the system. You'll go into the system. You'll enter in, again, your SVS email, this temporary password. You'll hit login, and then you're going to end up where I'm going to take you next. So this here is the SVS toolkit. And it's a very, very robust set of tools. They all are very professional. They all have been vetted by the PPO committee. Guidelines folks have taken a look at these, and like Dr. Mills said, I mean, literally within 10 minutes, you can go into the system, create a custom flyer for your practice that you can use immediately. So a couple things I wanted to point out. So when you first log back in, you're going to go up to the profile button. And again, all these instructions are going to be given. That we had a set of beta testers go into this toolkit probably 3 weeks ago, gave us their feedback. Hey, this was great. This needs a little polishing. So we were able to come up with some fixes. And one of the fixes was, let's present a lot of different resources in terms of how to use the tools. So you'll fill out your profile. You'll fill out your address, which will be blank when you first log in. And then very importantly, you're going to want to create a new password. So you're going to take that temporary password that you were given in the email, enter it here, put in your new password, click update password, and now you're ready to go. Now you're into the system and you can use them. So a couple of things that I want to point out. All of these tools have been developed by the SVS, by your professional society, at no extra cost to you, a member. There's no subscription fee. There's no download fees. These are for you to use. They're designed to help both you as well as, when used in mass, the entire profession. So they're available at no cost. Most of the tools are customizable, as Dr. Mills mentioned. You can put in your practice name, logo, contact information, even swap out the photos of ones from your practice. The only time that there would be a cost would be if you ordered professionally printed materials. So if there was a brochure and you said, okay, great, I want 100 of these, you can order it online through this toolkit as well from SVS's print partner, who's Elk Grove Graphics, who also was very instrumental in setting up this platform for us. A couple other things I'm going to point out that I would hope that you would get to before you start playing with all the tools. One, there's a quick reference guide. You click here. I would for sure open this, print it out, keep it next to you as you start navigating some of these tools and start customizing some of these tools. Another thing that we've made available is a how-to video. So it's almost a version of what we're doing tonight, where I show how to customize things, how to download things. Again, a good resource to have or go through ahead of time. The next thing is, and one of the things that I want to stress is, this is the first set of branding tools. This is a starting point. This is what we've identified as these tools are going to help our members have, again, more effective and efficient conversations with referral sources at this point. So as Dr. Mills mentioned, we're going to roll out additional referral source tools. We'll roll out tools for hospital administrators. We'll roll out tools for patients and consumers and other audiences. But the additional tools will be driven by you, the membership. We don't need to sit back and decide for you, hey, this is what we think would be really cool to build for the SVS members. So we want to hear from you, and we've actually provided as well a link right on this toolkit where you can go into a survey and you can start telling us, okay, these are the things I want the SVS to build for me. So this is what we'll rely on and we'll source in terms of what additional condition flyers should be built, et cetera. Last thing, and kind of the safety net, is an email that goes to Springboard. So that actually goes to me, it goes to my assistant. If there are questions that come up, if there are places where you all get stuck, do not hesitate to reach out to us directly on that email. It would apply as well to things that might be outside of the scope of this toolkit. So with all of that, let me show you some of the tools. You'll see there's different downloadable materials, there's primary care physician materials, podiatrist referral tools, the condition flyers, which we'll talk more about, some things that will help you have more branded email communications, a number of different social media tools to help you do social media advertising and posts, again, that are all branded. And then to further promote your practice and get your advertising, if you're going to do advertising for your practice, in front of people reading relevant content around vascular disease or vascular health, we have put together a set of banner ads or display ads for you to use, again, targeting primary care docs or podiatrists. With that, I'm going to dive into a couple of things here. So these are, for now, the downloadable tools. Now, at this point, these are not modifiable or customizable to your practice, but a couple of important things and some things maybe that you didn't know existed, like the member logo. To download this logo, you just click on the folder. Again, more instructions or a description here to tell you what to do. In this case, it's going to tell you to click on this download the SVS member logo. You see at the bottom of my screen, it downloads. I click on it. It opens up on my computer. And now I can save it. And I can use this particular logo in my different communications. I could put it in my email signature. I could put it on my website. I could put it along with a number of other communications to show, to show your commitment to vascular surgery and the fact that you are an active member in the SVS. The brand video, the video that you've seen now a number of times and you saw again before this particular town hall, is available to you. So you can put this on your website. Again, download the video. It's going to start downloading. And this will take a little bit of time, actually not too bad, but this is yours to use. So if you wanted to send this to a colleague, send this to a referral source, if you wanted to send it to your hospital administrators, you know what? You might think that we're only here for episodic surgeries and for trauma, but you know what? There's a whole lot more to our story. The primary use of this, I think, is going to become using it on your website. And speaking of website, we've provided some web copy as well. In this case, it's downloading a Word document. There's different information, again, on partnering with the vascular surgeon, explains the comprehensiveness, talks through the when to refer, why to refer to a vascular surgeon. So again, you can use this as is, but because it's a Word document, you could use it any way you want on your own website, whether you're a large health system or a private practice. This can supplement the vascular portion of your website. So if you ever get stuck, just click the home button and it sends you back home. I'm going to take you through one of these different pieces, and they mirror each other for the most part in terms of primary care physician and podiatrist tools. What's different are the photos that we use. Obviously, the podiatrist tools use photos of our vascular surgeons, dealing with lower limb issues, and the copy, obviously, in the flyers is going to be different because the needs are different for these two different referral sources. But I'll take you to the flyer that we've created for primary care physicians. So you click on that folder. Right now, I don't know if I'm going to order these or not. I might just download it, save it on my computer, and email it to people. But I do know I want to customize it. So I'm going to click the Customize button. The system then loads this in. And now these are the things that I can change. So a lot of this blank space down here is the variable data. So this is what I can fill in with my own information. The photos, again, if you wanted to keep these photos because they are very representative of the comprehensive approach to care of a vascular surgeon, you can use them. They're yours to use, but you can also change them out, and I'll show you how to do that. So let's start with the logo. I click over here on the left on the logo button. So one thing that you're going to want to do ahead of time, and something I think would be good before you really start in on these different tools and to customize would be create a folder on your desktop of your computer, put your logos into it, put some photos into it of your practice and your colleagues that you're going to want to use in some of these materials, so you don't have to go searching for them every time you work on one of these. But we created this fictional Anytown Vascular Surgeons as our practice, and I'm going to put that logo in. And if I hit Update Preview, you're going to see where it places your logo in relation to this particular flyer. So you can see it down at the bottom. If you want to see a little bit larger view of it, you can come up here and click Large, and it's going to show you a little bit larger preview of this. So what we've aimed to do here is we've aimed to create this really powerful co-brand for your practice with the SVS. And that's what we've done here, is we really clearly show that Anytown Vascular Surgeons, in this case, is a member of the SVS. So now let's put some more information in. Mine is auto-filled because I've done this a couple of times. So I've got my Anytown Vascular Surgeons. One thing that's strange about autofill, and I don't think this system is unique to it, is it puts the phone numbers in just as numbers. So if you wanted dashes between the area code and the rest of the digits, you're going to need to go and do that here, or put parentheses around. Go ahead and do that here. You can add in your practice website. So I'm just going to pick anytownvascular.org. So I'll update again here so I can show you what we've done so far before we move into the photos. So you'll see at the bottom then of this particular piece, it puts in your practice name, it puts in your practice phone number, your logo, your address, and your web address. So if you wanted to use this, again, with the photos that are in here, you're done. And you can print this out, save it on your computer, etc. But let's say you want to use your own practice images, which I'm sure most, if not all of you, are going to want to do. So again, the controls are over here on the left. I'm going to click Add Image. Oops, it's up here. I'm going to click Upload Image, and I've already put a couple of these in. We had, when we did that brand video, we had the members submit photos. And so I stole a couple photos that I could tell were from the same vascular surgeon. So now I've uploaded the photo into our system, but you see this highlighted area, and I'm going to move it around a little bit. This is the portion of the photo that's actually going to appear in this particular flyer. So if I want to highlight our vascular surgeon and our patient, I'm going to put it there. I'm going to click Finish Cropping. And then if I hit Update again, it's going to show you that it's replaced that photo on the left of Dr. White with our new image. So it sizes it for you. It's really, kind of no fuss, no muss in terms of adding these photos. So I'll add the other two again, just so you can follow along. Click Image, click Upload Image, select the photo that you want to use, open. It loads it in, and now I'm going to crop it. So again, if I want to move it around to get this consultative session here between two clinicians, I can do that. If I wanted to grab the corner and really focus in on one, I could do that as well. So you can play around with this window and put it so it gives you exactly what you want in your particular photo. So I'm going to come back to about here. I'm going to click Finish Cropping. And instead of updating again, I'm going to add this other image. Upload. Let's put the right one in. Open that up. And then again, let's move the highlighted area around. Do I want to show more of the patient and some technology? Or do I really want to focus in on our clinicians here? So I'm going to select that area, finish cropping, update, and it will show you how it placed those other two photos into the into this particular flyer. So there you go. Now, a completely customized flyer that you've got to use for your practice. Again, these are designed for referral communication. So, you know, you meet a family practitioner and, hey, send me some more information on what you do or your approach to care. You go in, you make this, and you've got it. So now it's done, or if you deem it's done, you've got a couple of choices. You can save it for later. I would only do the save for later if you're going to come back to it quickly. There is a shelf life here. It's 60 days, so it's not like it's going to disappear right away. But you're better off finishing it, or in this case, downloading it. So there's this little icon here. And again, in the instructions, it tells you that this is your download icon. So you're going to download your proof. Again, it shows up right in the bottom of your screen. I'll click on that. And there you got your completed flyer, all ready to go. So from here, you save it on your computer. It's going to assign it this crazy name. So rename it something that is going to make sense to you. But now you can save this PDF on your computer, and you've got something that you can go ahead and use to email to colleagues. You could print them out locally at your practice or at your hospital, anything you want to do with them. The other option that you've got is ordering some prints. So if I'm done and I look at it and I go, okay, yep, this is everything I want in this piece, I'm going to click Finish Editing. I'm going to approve it. So always good to look at it one more time. And I'm going to add it to my cart. So this is what you would do if you wanted to order professionally printed proofs. If what you want to do is save it on your computer to email, save it on your computer to print locally, you do not have to go through this process. But let's say I do want to order some. So the default is going to be 0 in terms of the quantity. So I'm going to go in and edit that. I'm going to select my quantity. Let's say, you know, we've got a big all staff meeting coming up. I want 500 of these because I really, really like them. And then I'm going to add them to my cart. And from there, it really is like ordering anything else online when you complete your purchase. So you'll proceed to checkout. I have a couple other things in here already in addition to this, but if you wanted to click on, again, sort of a thumbnail of what that looks like, you can click on it again, and just to make sure you've got everything the way you want it. So that's how you order. One important note is that we do not, through this system, save your credit card numbers. So yes, maybe it's a hassle to re-enter your credit card number when you place orders for professionally printed materials, but it's a security issue. SVS does not need your credit card numbers nor want your credit card numbers, and you probably don't want them out there anywhere else anyways. So that's a flyer. Let me go back to the home button. I'll show you one other thing here, and then we'll kind of move on. There's a 4-page brochure, and it happens to live in the primary care physician tool area, but it's 4 pages, and I'll just show you one thing here, which is how to navigate between the different pages. There's a little instruction here up in blue above it, but you know, here's the cover. In this case, you can swap out all 3 of these photos if you'd like. If you want to look at the next pages, you go here. So right now we're looking at page 1. If we want to see page 2, we can change this photo as well with one from your practice. Now, what you cannot change is the content. Again, this content has been approved by the SVS, by the PPO committee, by guidelines, and it's not something that we want people to be able to go in and just change on their own. This is the third page. Again, a couple photos. One looks kind of familiar that you can leave or swap out. And then the back page is where you put all of your practice information. So just like I showed you on that flyer, you don't see it now, but in this case, your logo is going to go up in this area. All of your practice information is going to go down below it. And you can even enter in physician names to the right of this as well. But again, you've got a 4-page brochure that, again, you can download, save as a PDF, email to people, print locally, or order professionally printed versions. So let's go back home, and I do want to spend a little time too on these condition flyers. So as Dr. Mills indicated, we've built them a couple different ways. We've built them so that they're customizable, and I'll show you that actually second, where again, you can put your practice information, you could put your practice logo, etc. into them, or we've designed them as SVS branded. So in Dr. Mills' presentation, he showed one of these. I'll just go ahead and download this and show it to you. This one for AAA. Again, front side of it explains what the condition is, when to refer to a vascular surgeon, why refer to a vascular surgeon, and then a pretty to the point group of guidelines, but not all of the guidelines. So once you save this onto your computer, it's also clickable here. So there's a link here that goes to a page on the SVS website that I'll show you in a second. Actually, I'll show you that now. You'll click on that and you'll end up at this particular page on the SVS site. Same information on the beginning of it, talks about the condition, when and why, but it now gives you the full guidelines. So it's many, many pages, but this would be a great link that you could email to someone. If you had a referral source that said, you know what, I've got someone that I think you need to see for AAA, you could send them this link, either copy it here or use this mini link here. The reason that we built these particular versions that are SVS branded, in addition to the ones you can customize, is, and I'm sure some of you are in these systems, there are health systems out there certainly that are going to be very, very restrictive to their brand. So I'll kind of make up one, and just like I've made up Anytown vascular surgeons, let's say it's Anytown Health. Is your system, or Othertown Health, let's say, so it's not the same. But they might be very, very restrictive in terms of they don't want you to use anything that doesn't have their brand on it, that isn't in their brand colors with their logo on it. They may not understand why there's an SVS logo or a member logo with it. What we have found in working with a number of other medical associations is that using materials from your professional society, is fine. This seems to be the time where, the organization that you should be referring to for help on AAA is the SVS, and by all means, you can use materials from the SVS to have referral conversations. We will eventually build versions of these for patients as well. If you had a patient that came in and you could hand them this one pager with information, and it's information from the premier authority on vascular health. So those are the flyers. Let me show you the customizable one real quick. So customizable, and I'll pick a different one. Same way that you're going to customize these, like I showed you before. You click on the folder, you click customize, it'll load it into the system. in this particular case, the front of it is locked in place. The place where you're actually going to put your own information is on page 2. So as the little note up here says, you're going to want to go to page 2. And just like I did on the others, and I'm just going to put the logo in at this point. But just like we did on the others, there's space at the bottom here where you can enter in your logo, your practice name, address, website, etc. onto this flyer. So now not only are you giving a referral source a flyer on why they should refer to a vascular surgeon for CLTI, but you're giving them a piece that also references you and your practice. So I think very, very valuable. This CLTI has a matching page on the SVS website as well that has the extended guidelines on it. And then there may be other tools coming for this. You know, if you wanted this particular condition information in PowerPoint slides, that's something we would love to hear if that would help. But once we develop the template and we have this flyer and we have the additional information on the website, we can build a number of other pieces for it. So I've been going for a little bit. I'm going to talk a little bit more about some of these other things, but I wanted to pause real quick. I know sometimes I just get going and don't stop. But any questions at this point, or keep going?
Well, Mike, let me ask you, there's been a couple of texted questions. I don't know that we need to switch over to the text to screen thing here. I can just read them off. One of the things that I noticed too was that you make reference to member of the Society for Vascular Surgery. And Isam has asked us, will these say fellow? Can that be customized to say either fellow or distinguished fellow? Because we do have different categories of members these days.
You know what? You read our minds. Actually, on the short answer, yes. On this survey, we actually have a question there. It came up in conversation a couple months ago. But I think there is a question. Oh, of course, I can't find it right now. Maybe on the second page of this, but yes, we're asking the question, should an identity, much like we've developed the member logo for the SVS, should we identify, or should we create an identity to identify fellows and distinguished fellows? So we're asking that in the survey before we go ahead and just build it, but that is absolutely possible.
Joe, what do you think, or what do the panelists think about that?
Yeah, I think it should be easy to do. We discussed this. The initial one we just made SVS member, but I have no problem with people. I think it's an easy thing to do. There was a question from Dr. Schutze. So some practices either practice at multiple hospitals or they have multiple offices. So how would they, if they didn't want to come up and have to fill out a form for each individual site, is there a way to list multiple sites? Is there a room for that? Or how would you go about that?
You know, within what we've built today, it's not going to be as easy because you've got the space for a logo and you've got the space for your practice. You could put in, we would have to try it. So that's one of those good to knows, and we should look at it. You could put in where it asks for the practice name, multiple hospitals, if there was multiple hospitals that you practice at, and then a single phone number. I'm not quite sure how that's going to populate inside some of these materials, but that would be one way to do it. The other way to do it would be to build a version of it that maybe instead of having a practice logo or in a place where you would put physician names, you could put the different hospitals that you practice at. So I think short answer, there's a way to do it, and there's probably a way to do it now. But if that's something that is needed, it is something that certainly could be done.
Yeah, I have a question for Mike. I noticed when you uploaded the practice logo, it was a PNG file. Are we limited to just those type of files for the practice logos, or are there other file options that we can use? So
it downloads as a PNG file. Again, if we need more file options, this could be a folder, and you could choose from, you could choose a JPEG, a PNG, a PDF, LMNOP, you know, whatever all the flavors of the logos are these days. The reason it's a PNG file to begin with is it doesn't create any background behind it. So you could put it over the light portion of a photo, for example, like if I'm looking at your background on the beach there in Texas, I could put it in the upper right or upper left corner as a PNG file. Yep. And it would show up just fine. It's not going to have a background. It will show up, and the light blue or the clouds are going to be the background. If you want a different type of file today, you would download it, and then on your computer, you would actually do a save as, just like you were going to save a Word document as a PDF. You would open up this particular logo file, and you would do a save as, and you would choose to save it as a JPEG if you wanted a JPEG. Now, a JPEG is going to put a white background behind it, which in some cases might be better for you. So
Mike,
some of the
question from Anil Hingarami, who's asking, are these tools only available to SVS members, and where do you go to get them?
So yes, and you'll find out next week. So yes, they are only available to SVS members. You will get an email early next week, thinking Tuesday, Wednesday, with that invitation to change your password. So just like I shared at the very beginning, you're going to get an email. It'll give you that link. You'll go in, you'll get a temporary password and start entering it. But we're going to have to be a little bit patient in terms of you can't get in there tonight. But it will be monitored by the SVS. Only members can get access to the passwords and then get access to the particular toolkit.
All right, we'll let you get back to your presentation.
All right, so let me show you a couple more things here. Some you're going to use more than others. Some have been built purposely in advance so that when we're ready to start communicating with other audiences, they're here. Another one that we've built are email communications. So, you know, let's say you wanted to create an email and it was going to go out to a number of different podiatrists, let's say. You could choose this image and put it at the top of your email that you're going to send out. Just like everything else we've built, you can customize it. So again, you can put in photos of your own practitioners. You don't have to use the ones that we've populated already. We've also created some sample email copy. So again, this is a Word document, and I'll just zoom it. I don't know if you're going to be able to see it real well, but I can make it a little bit bigger. So this is sort of a general primary care email. This is a general podiatrist email. Again, all of this is in a Word document. You can copy and paste it, use it as is, or you can change whatever you want to in this particular email message. So at least we get you started, is the goal of this. And then at the bottom, and this may be something that members want to use going forward in all of your email communications. Again, you got to check with your health system. If the health system doesn't want you to have anything but their logo in the bottom of your email, that may be a problem. But this is designed as a footer image that you can download and just add it right to your email signature, so that now all the emails you're sending, whether they're going to practitioners that you want to develop referral relationships with, or patients, or whomever, again, you've got this graphic that you can put at the bottom of your email that again shows that you're a member of the SVS and reminds everyone that surgery is only part of our story. So a couple tools there in terms of email tools. And again, in the survey that we do, we're always asking how valuable these tools are and what else we should be building to help you out. I think another one, though, that you're going to find useful from the very beginning are the social media tools. So there's ads and there's posts. So the ads you get to pay for, but you can target them very specifically in terms of who the audience is that you're communicating with. The first ones that we've built are geared towards putting ads out or doing posts on Facebook, on Twitter, and Doximity. I would say that Facebook is going to be a little bit stronger for you once we're communicating with consumers. That's where consumers live in terms of social media platforms. The ones that I think you're going to use now for referral sources are going to be Twitter and Doximity. I don't know. I assume all of you at least have access to a Doximity account. I don't know if everyone has claimed theirs. But what you're going to see in here are a couple of things. One, this doesn't go quite as far as some of the others, but there's downloadable how-tos for all of these different channels. Again, you click to download it. You can have it as a reference or you could print it out. But it gives you an overview, in this case of Doximity, who the audience is you're going to best reach using this particular channel, and then some help on creating a post. The other things that are within all of these folders are images and particular copy for posts. So again, the copy is a Word document. I believe we've got 3 different posts that you might use to reach a primary care physician, a couple of different posts that you might use to communicate with podiatrists on Doximity. Again, Word document, editable, change it to whatever you want, but at least this gets you started. The next that I want to show you are the images. So just like all the other images that we've put in here, they're customizable. So here's an image that looks very familiar, like the rest of our branding. This one, again, is the primary care doc version. This is the podiatrist version. You can change out all of these photos, just like I've shown you on these other ads. But we've included just a couple of other images in here, and I just want to show you this real quick. So I can download this image if I just want to use it. It's perfectly fine. It doesn't, you're talking to, you're posting something about the vascular surgeon's value to podiatrists. This is a perfectly fine image for that type of a post. But let's say you want to customize it. You can go to the Customize button again. And again, you'll start to get the rhythm of this pretty quickly once you get in and start playing around with it. So you hit the Customize button, you click Add Image, you click Upload Image. Let's see, I'll pick this one. You open up the image, it's going to load it into the system. And there's one kind of cool thing about it that I'll show you once we've got this built. So again, it's going to ask me to highlight the area of this particular image that I want to use. So I want to make sure I get everyone in here. But maybe on this one I can get in a little closer. So I'm going to grab the corner and bring it in a little bit more. I'm going to click Finish Cropping. And then update the preview. And the nice thing about this is not only will it put that photo into this particular image that you can use to post on Doximity or Twitter or Facebook, but it keeps this member insignia or swoosh in here. So again, the post that you're making, if you chose from this point forward, if you're going to tweet things that are vascular related, you had an image that went with it, whether it was the image we used on the CLTI flyer or whatever it was, you could put it into this particular builder and it will add the member logo to it. So you've got it and you can use it. So that I think is nice, and feel free if you want to use it on all of your Twitter posts, Doximity posts, Facebook posts or ads. But there's one quirk of this system. We've done our best to explain how all this works in the different how-tos and the different videos that we've done on how to use this system. But it downloads everything once you customize it as a PDF. So if I go to this download proof, and this maybe gets a little bit to Dr. Schutze's question as well, it's going to download this image as a PDF. I click on it, it's going to open it up. So now I'm going to need to save this, and first I'm going to have to move that. I'm going to save this. You know what? I'll just save it as this crazy name because I'll be able to find it easier. But I would take this opportunity to change this computer-generated crazy name to something that makes sense. But I can go ahead and save that. And now I can go back, open up that particular folder on my desktop. Here it is. I open it up as a PDF. And then this is kind of how you would change if you wanted to change something from a PNG file to a JPEG file. In this case, we're changing it from a JPEG. So I click File, I click Export to, and in this case, I'm going to choose Image and JPEG, because when you post things on Doximity or Twitter or Facebook, it wants you to post it as a JPEG image, not as a PDF. So now I've got it. It's in my folder as this crazy number JPEG, and I'm ready to use it in a post. So that's one kind of quirky thing about the system is you may have to change the type of file from time to time, but should not be too prohibitive. So let me go back to the other social media real quick. The rest of it's going to look very, very similar in terms of the assets that you have available for Facebook or for Twitter. All of the images are essentially the same. Again, you're going to have a how-to guide that you should open up and download that will help you through the process of creating a paid Twitter tweet. So once you pay to advertise in these different platforms, instead of it just being a post, and the people that might follow you, or you might add a hashtag that people will catch you at, with the paid versions, you can target who sees it. And I'm sure, you know, if you're on Twitter or you're on Facebook, you get ads all the time in your news feed. And it's just like that. So the post that you make here on Twitter is going to end up in the news feed, but you're going to be able to target. You're going to be able to target geographically. You're going to be able to target based on topic, etc. And the same with Facebook. Question came up earlier. What about LinkedIn? And LinkedIn is a communications platform that is obviously very powerful. LinkedIn will get added into the system as we develop more tools for hospital administrators. It's a little bit more of a business tool. It's not as good of a to consumer or to physician type of a tool, but it will be very valuable if you want to post things and target them, or place ads on LinkedIn and target them to hospital administrators, for example. Last thing I'm going to show you are the video segments. Dr. Mills mentioned these. They are very appropriate for social media. There are 5 of them. It lists the names. They essentially are snippets of the 2-minute brand video. So again, you can click on any of these. It will download it. And then once you've got it, you can use it however you want to. And probably, again, most appropriately, to add to a social media post or ad. We've also got sample social media copy that can go with each one of these videos. So, you know, let's say the first video is 20 seconds on, you know, the vascular health team, and your tweet could look like this. You know, this surgery is only part of our story. Today's vascular surgeon teams up with you to provide, et cetera, and our hashtag comprehensive vascular care. So each video has its own set of, in essence, starter copy. Again, you can use what's here. You can you can freelance and use whatever you want, within the confines of how many characters, et cetera, with Twitter. So I believe the social media tools will be really good for you. And especially if you're a private practice and you want to use any of these tactics to target referral sources to essentially create awareness for yourself, for your profession, for your practice, social media and social media ads, I think, are going to be one of the places you're going to want to be for sure. Last thing I'm going to show you are banner ads. So, I'm sure that you've all been on websites where there's different banner ads. Some are crazy and have way too many. But you can place a banner ad. Again, this is all customizable. You can put your logo in here. You can put your photos in here. And then this how-to guide is going to help you set up a digital display or a banner ad advertising campaign. So you could set it up where the ads that you create appear on relevant vascular health, vascular disease type of content. So it's not like if I'm reading about LeBron and the game he had last night, your ad's going to show up, but it's going to show up if people are reading content online about diabetes or wounds that won't heal or blood flow issues, et cetera, et cetera. So that's where your ad's going to show up. Again, can be helpful now. Communicating with referral sources probably becomes even more beneficial once we move into more of a consumer-facing portion or phase of our campaign. So those are the tools. And I think, again, I applaud the SVS. We have done this many times for other medical associations. They typically stop before they're customizable. They typically stop before putting them online and letting you make changes and use them yourself. And there's something that the society might just send you on a thumb drive. Hey, here's a bunch of materials for our specialty. Go ahead and use them. But as much as you might enjoy the physicians that are on some of these pieces, it's really nice to be able to do pieces that have your own images on them, so you can show the people within your practice, or show you if you're a single practitioner in a number of different phases of your comprehensive care. So with that, I'm going to stop. I'm going to remind everyone that once they do get access next week, a couple of things. Please print out the quick reference guide, watch the video. It'll show you a lot of the things and remind you of things. Or if you get stuck, come back to them. But tell us, we want to know with this survey feature, what you think of these tools and what additional tools should be built next. Again, this is the starting point. The goal of the SVS is for the branding effort to be a multi-year project. It is not a one and done. So tell us what else will help, and we'll do our best to bring those to life.
Great. Sounds like you guys have been very busy working on all this stuff. Joe, I'll kick it back over to you to consult with our panelists.
Yeah, so we picked our panelists because they're in a range of practices. And so I kind of wondered from each one, if we can start on my screen, I guess it would be Dr. Schütze first. How do you see yourself using this in your practice setting? Maybe describe your practice setting, things you see that would be really useful, and then any barriers or hurdles you might have to work with to use them. And then things that you see that might be missing, things we could work on. The same question for Linda and for Bernadette.
Well, it's interesting. In private practice, we have some advantages and disadvantages to being affiliated with an institution. The advantages is we don't have a lot of the firewalls that prohibit us from accessing and utilizing all of the material. Disadvantage is we have to do this in-house ourselves in our small practice, and may not have the same resources people have coming out of a big institution. However, what this branding toolkit has done, it has made it so that it's facile and easy to do fairly quickly. In fact, while I was playing around with the beta testing, I mean, it really, within probably an hour, I had customized 4 or 5 of these different products, and it was actually very, very simple. And I've kind of cheated. I'll make an admission here. I went ahead and downloaded the banner the other day and put it on into my Epic template. So anytime I sign a consult or co-sign a note, it shows up with the SVS logo. So anyway, I hope I don't get in trouble for that, but I've already found a use for that. My daily in and out use of these products, I think having the hot links to the SVS resources for AAA and CLTI and DFU on my desktop, I can just embed those pretty quickly, either into an EHR note at the hospital or into my own correspondence that goes electronically after I've seen a patient with one of those conditions. And of course, and easily attach if I want to, or I can spontaneously send them to perhaps either a referring physician I haven't heard from in a while, or maybe a brand new referral physician that I'd like to kind of encourage to send some more patients to us. One and another admission, and this is kind of embarrassing, but in preparation for the launch of this branding campaign and tonight's town hall, I went back and looked at our website, and I hadn't looked at our website, practice website, in a long time, and I mean our website is terrible. It's awful. And you won't believe this, but there's actually, we've got some video. We had 3 videos, and one of them's a pacemaker video. Why we have a pacemaker video, I have no idea, but I know exactly what I'm going to replace it with now, and it's the SVS branding video. So we're going to get that taken care of. You know, I think that there's so many different ways you can adapt this to your own situation. I'm excited to discuss with my younger partners who are going to help me with the project of implementing these branding tools into our practice and see what their thoughts and how many different ways we can come up with this. And the other thing that I like is just the fact that you can, it's once you've done it, you're not stuck with what you've got. For instance, I can, take my iPhone, take a picture and go, wow, I really like this. Maybe I should put this onto our already, downloaded and branded flyers. And it's so easy to move this stuff in and move it out. So I don't want to take up too much of the time. I'd like to go ahead and let the other panelists give their thoughts, and I'm happy to contribute again later.
I think Bernadette's next, at least on my screen.
Well, what I love about the toolkit is the malleability of all of the options. So, and I think I agree with the other comments that how we use this will probably vary based upon our institutional or hospital-based regulations. I've already learned a lot about what I can and can't do through our marketing group. So I'm at an academic institution, and there are some restrictions on what we can or can't put out there, but our marketing group is all for using the communications through the toolkit that have the SVS branding. And I think as we use these, we'll figure that part out. My institution won't let me use the branding video since it features other physicians, but modifying all of these flyers and communications with photos that include our group or our institution will be a great tool to making this roll out. I also think that incorporating the clinical practice guidelines and more information that we send out to our referring physicians is really helpful. So I think I just want to congratulate Joe and the group that worked on this. The flyers that exist are so detailed, and they just make it easy. They make it work. So I'm hoping that we get a lot of feedback from those of you watching on other areas to cover or different things to think about. I agree that we'll need to think about how to incorporate multiple hospitals or multiple providers onto these sheets in terms of just covering all the bases. But this will make it easy to do what, on some of these communications, I've spent months working with our marketing team to bring things together And so this, I think, will make it much more straightforward.
I think Dr. Lee's next.
Yeah, so I think the branding toolkit would be very useful at my institution. I actually discussed this with our marketing director, and they were pretty enthusiastic to use these. At least she wanted to take a look at what we had to offer and potentially use some of this on our Methodist website. One thing that is lacking at Methodist, our marketing department is pretty robust, but really like what Mayo Clinic has is the patient education items on our website and our marketing department. So they really were interested in the condition flyers for patients. I know personally, when we give our patients the after visit summary, this would be a nice addition for them, just so that they can look over what we had discussed in clinic and society guidelines. Also to letters to the consultants after we see patients, to sort of add that on the bottom of that letter, so they can kind of read about, when to refer to us and what is appropriate standard of care. So, more news to come, I think, in terms of working with these large system-wide hospitals and what they can use from this toolkit.
Yeah, I think how you work through the details in each system will be a little different, but I think all of us have a need for up-to-date information. And usually what happens with most websites is you spend a lot of time getting them up and then they sit there. And so then there's this every 5-year, you go back and look at it and find the pacemaker video and other stuff and figure out how that happened. So I think it would be, at least in our Epic, you can get the up-to-date information to patients. And that's part of Epic. I can just click on it and I use it for certain conditions. And I'm pretty sure if you went through your institution and got approval, you could probably get permission to use the flyers once usually what they look for is to make sure there's no copyright issue and that there's nothing offensive in it. And it's very good information. And we've gotten the printed flyers before, when this older version of this, and we use them for a while, but after a while you get tired of printing them or you run out of them and then you don't use them. But it would be really nice, as Dr. Schütze said, if you can add this to your notes, or if you see a patient, you click on a button and they get the condition flyer. And we can work on these. When we get to the patient-facing parts, they might be different. So those of you familiar with UpToDate, the part that's available for patients is actually free. So even if they don't have an account, they can get those. And those are more down to earth and less detailed than you might send to a referring doc. So if you get a really strange condition and you want to send the referring doc a note, and we eventually have that flyer, they'd be more interested maybe in the complete guidelines. Whereas for the 2-page flyer, we've got kind of a condensed version. But I would see this, if people like this, I would see as we roll forward from referring people to institutional settings to patients and consumer facing, that the flyers might be different depending on the audience.
So Joe,
there's a nice set. There's a nice set of the vascular condition or vascular health flyers that I've used for a while that are available in English and Spanish on the vascular.org. Joe, do you see those coming into this and being customizable? The only thing about those, I don't know that they're able to be customized at this point to list the institution name or the physician name.
Yeah, I think I would vote, I guess we'll discuss it, but that should all be in this area on the website. And then all the tools that you might use would be there in one place. So you wouldn't have to go to 4 different icons to find what you want. And then that would probably need to be reviewed by the PPO just to make sure the information's not dated. But the idea, I think this relationship with Springboard is more long-term. And also this project, this is the first year of really having something to show you. So I anticipate it's probably going to take 3 to 5 years to get the whole portfolio built out. Now, if there's broad agreement on the modules, I think those can be created relatively quickly, because the template, that was the key thing we had to notice there is, how do you set this up to make it reproducible and not have to have a different template for every condition? And what kind of things do you really want to emphasize? So 1 is something about the condition. 2 is why should you refer it? When do you refer it? And then for the things that there's guidelines for, I think that's a great way to push the guidelines out to the community. And then that's branding us, right? If we have our guidelines, they're evidence-based and that we use them, that's the strongest brand we could possibly have, I think.
So Joe, there's a couple of text-to-screen questions here. One from Dan Alterman asking if it's going to be possible to insert practice logos into the branding video.
Yeah, we talked about that yesterday. So that's not ready yet, but we're anticipating, so you wouldn't be able to change the content. What we discussed was at the very end, as you're playing away, we could have a screenshot, for example, of your group or your hospital or your clinic with your whole staff in it if you wanted to, with your logo on it. And that would be a slot that you could, the format, use QuickTime Player, I believe. So they could be edited. I'm sure there's somebody in your office that knows how to do that if you don't. But the idea would be, once we get approval, which I think everybody will agree with, that we allow those to be brandable by putting a space at the end to, sort of like you do with the flyers, right? You have that one corner where you can put your own logo on. Same thing with the videos.
So a similar question has come from Hillary, who asks, is the red primary color customizable to their practice colors?
I'll take that one. That is a no. That is the red is the SVS color, and you know, primarily the branding of these different materials. It is SVS branded. You're able to add in your practice logo, but they are SVS pieces, and to create that strong brand for the SVS, we want to make sure that everything that comes out that has its name on it as well looks the same. And so that one's unfortunately a no in terms of turning that red into hospital blue or whatever other color you want to make.
So another question is, when will we be developing consumer-facing communications?
So
we have to, go ahead. Yeah, we covered that a little bit, but probably about 6 months or so, 6 months to a year. But they'll be based on these templates. I think will apply also to consumers in some ways. We also might, in addition to condition ones, probably create some procedure ones. Unfortunately, some of our competition, there's advantages and disadvantages, right? If you brand yourself as comprehensive, it's a little hard to explain what that means. If you want to get people into your office for uterine fibroid embolizations, you just say, I've done 8 million uterine fibroid embolizations, and you show a couple of happy pictures and you keep branding that one procedure. So we don't necessarily want to brand ourselves as proceduralists, but we do lots of procedures. So I can see when we get to the consumer facing one, in addition to having condition flyers. So those would be for the patients that first show up and they have PAD, what's that? Or they have a foot ulcer, or they have venous insufficiency. There'd be a condition flyer for that. And then when they get to the stage where there's options for procedures, you could easily see short videos and probably little flyers about each option, like foam sclerotherapy versus RFA versus stab phlebectomy. I could easily see, and the procedures might be different, right? You might emphasize different ones in an office-based practice, for example, than when you're talking about bigger cases that are done in the hospital. But that's definitely part of the plan.
Yeah, I'll add on to that. Thank you, Dr. Mills, and say that as we looked at this from the very beginning, it was, okay, what do we need to do, and what's the priority here? And it was identified fairly quickly that referral sources are our priority. We really need to solidify those referral relationships. We want to be able to add and help you add new referral relationships. But since most of your patients are going to come through referral, let's nail those first. Let's really solidify those referral communications so that you can have these conversations. And then over the course of time, and 6 months is probably about right in terms of developing patient-facing materials and consumer, sort of general consumer, what is a vascular surgeon, so that the rest of the population understands that you're not just proceduralists, et cetera. But I'll add as well, Dr. Olivola brought up the patient flyers that have already been done. The SVS Foundation did these a couple years ago, and they're absolutely fantastic. They're in English, they're in Spanish. I don't see any reason that they won't end up in this toolkit as well. They're absolutely great. What we'll have to talk about a little bit more is, again, are they going to be provided in two flavors? You know, one kind of as is, and another flavor where you can customize it again with your practice or your hospital logo, et cetera. So we'll have those conversations and make sure that that all works. But those are fantastic, and there's no reason to not use those.
Yeah, the two other components that haven't been measured, one is marketing yourself, our specialty and our practices, to hospital administrators. So it didn't come up in the discussion yet, but the valuation report that Rick Powell did, we're looking at how to incorporate that. So ways you can share sections of that report, because we're having this discussion now with our hospital administrator that we work in so many different venues. They actually don't appreciate what we do every day, because we work at Children's, the main hospital, the cath lab, and OBL, outpatient clinic, and they forget the scope of what we do, and they don't understand all the different things we do in the hospital to help other providers out. So except for acute care surgery, I mean, all of you know, we're the most commonly called specialty when there's a bad problem in the operating room. So those kind of conversations are important to have with hospital leadership, and we're going to try to incorporate that into the toolkit. And then the final thing for those of us in academics, even those that aren't, is branding ourselves to medical students and surgery residents so we can increase the applicant pool for our specialty and get a broader representation of the people out there. And so that's going to be part of what we do.
Well, Joe, this has been a great panel. It's obvious you and your group have been up to a lot of work here. I'd like to kick it to any of the panelists for any kind of closing comments or so, and then we'll wrap it up.
Yeah, just one other thought. The audio part of our branding video, I think, is going to be released as a standalone, or you can actually, once it's downloaded, you can actually rip it out of the video. And one thing we're going to do in our group is take the hold music we have and replace it with this audio from our branding, because it's such a powerful recording.
Linda, Bernadette, any closing comments?
I'm just excited to get this launched and see what other areas we can expand to. Really, another just congratulations to the group that's spent a lot of time working on this and developing the flyers that are already in the toolkit.
Yeah, I echo what Bernadette is saying, and thanks again, Joe. You've done a great job this year as chair, getting us all together and working on such a big project for the National Society. It's looking great, and I'm excited to see what's going to happen in the next couple of years.
Thank you. We had a lot of help. We had a good group, and Springboard's been great to work with. When you do this kind of thing, doctors have a certain idea what marketing is, and marketing people do also. So you have to kind of figure out what wavelength you're on. And once we got there, I think it worked very well. It doesn't mean we can't do better, and the thing I want to emphasize about this is we want to moving forward, and this will be something that we'll update. And certainly the way we have it set up with guidelines, if the guidelines get updated, it's going to be relatively easy to change that aspect of each condition flyer. And the same with procedures, as like for TCAR, for example, as more data comes out, I can easily see that kind of flyer. If you're trying to talk about what specialty offers all the carotid options, that's only us, right? So anyway.
All right. Well, once again, congratulations to all of our panelists, Mike and Joe, for putting together a great panel. We thank everybody for their time and participation, and we'll see you at the next town hall. Thanks, everybody. Good night.
Good night.
Good night.
Each year, millions of adults in the U.S. are diagnosed with vascular disease. And it's no wonder. With over 60,000 miles of intricate arteries and veins throughout the human body, there are bound to be complications due to blockages, weakening of the blood vessel wall, and other issues impacting the circulatory system. With an aging population and the growing incidence of risk factors such as diabetes, high blood pressure, obesity, smoking, and the disproportionate incidence of vascular disease in our minority populations, the management of vascular health is becoming a key focus among today's healthcare leaders and providers. As with any medical disease or condition, it takes an entire team of dedicated professionals to find new ways to efficiently diagnose and treat patients, as well as to improve their long-term care. In vascular health, the leader of the team is today's vascular surgeon. Only vascular surgeons dedicate their entire training and practice to address the full spectrum of vascular health, as well as provide comprehensive care that includes preventive, medical, surgical, and minimally invasive solutions. Through ongoing education and research, as well as pioneering new techniques, vascular surgeons are on the leading edge of clinical breakthroughs that are transforming vascular health. As part of their comprehensive approach, vascular surgeons partner with other healthcare professionals to provide quality care tailored to each patient. This patient-centered model is vital to help all physicians manage vascular health in at-risk populations and promote healthier lifestyles in the future. Vascular surgeons are involved in every part of the disease process, from making the diagnosis to the management of disease. Vascular surgeons are comprehensive leaders in vascular health. Today's vascular surgeons are creating a new chapter in the vascular health story with improved patient care, better outcomes, collaboration, and leadership. Surgery is only part of our story.